Driving after heart attack. Commonly, everyone wishes to be back on wheel as soon as possible after heart attack. However, after immediate medical stabilization, you may need time for your heart to recover. Your daily living, including driving, may temporarily affect it. You may not drive for 4 weeks after a heart attack or acute coronary heart syndrome. In some cases, you may be able to drive 1 week after your heart attack. However, if you have a stent inserted after a heart attack, the driving restrictions may be different. Most people can resume driving after 4 weeks as long as they do not have either rhythm disturbances of angina while driving. Motorcycles are included in this group. If you are unsure, check with your doctor or cardiac rehabilitation nurse or occupational therapist. If you have angina, you may continue driving as long as your symptoms are controlled satisfactorily by medication. If you have angina while you are driving, you must stop the car and take your GTN. Make sure the angina discomfort has gone completely before starting to drive again. You may not drive if you have angina while you are resting. You must at all times make sure that you can safely control the vehicle. Remember, take your GTN spray or tablets with you, just in case you get any chest discomfort while driving. If you have had cardiac surgery or bypass or CABG, you should not drive for 4 to 6 weeks. We encourage driving only after 8 weeks. You should discuss with your surgeon before you start driving. Ideally, you should have your sternum checked by the surgeon before you start driving again. There are very few circumstances which would actually disqualify you from driving. When you first start driving again, you may find that you have lost some confidence, so it may be best to avoid long journeys or peak hour traffic until you feel more comfortable behind the wheel. Sometimes, be a passenger, you feel comfortable, relaxed, and less stressed. You might prefer to start with a short, quiet drive with a friend or partner to help regain your confidence. For car driver, it is not a legal requirement to inform JPJ that you have had a heart attack or heart surgery unless you have pacemaker or implanted defibrillator or have recurrent angina provoked by driving. If you have a hypo or low blood sugar while you are driving, you must stop the car and take the keys out of the ignition and have a snack, such as glucose tablets or a snack bar, and wait until your sugar is above 4 millimole per liter before you continue your journey. If you are driving a commercial vehicles, the guidelines are different. You need to inform the JPJ and pass a full driving test. If you are angina, you are only allowed to drive after 6 weeks if you are free from angina. Medical information may be required from your attending cardiologist before you retake your license. This is a general guide to help you to go back to driving after CAD. It may vary for one individual and condition. If you have doubt or further inquiry, please do contact your physician or occupational therapist for assistance.